The following segment will discuss blepharoplasty, or surgery of the eyelids.
Surgery of the eyelids, commonly called blepharoplasty, is a very frequently performed plastic surgical procedure. It is both useful as an independent procedure and also when combined with other procedures, such as a facelift or browlift, to alleviate the signs of aging. Removing excess skin and fat from around the aged-appearing eyes can provide a more youthful and rested appearance. Patients in the previous segments on facelift and browlift can also be followed during their healing process, as those patients also had surgery on their eyelids. These are 5-week after photos of a patient who had a browlift upper and lower blepharoplasty performed. This may give you an idea of what you might look like at this early stage, although patients heal differently. His eyes are still swollen at this stage, but the incision on the outside of the eyes in his case are not very noticeable. Drooping of the brow contributes to the hooding or excess skin on the upper lid, as well as just simply having excess eyelid skin. Your surgeon will have to determine which anatomic problem contributes the most and pick the appropriate procedure. You have to make sure you know what his or her artistic goals are, as they may vary considerably from what you want. Obviously, this patient has additional skin that could be removed, but I feel that removing more would look less natural. These are isolated before and 2-month after photos of a patient who had a browlift and upper blepharoplasty performed. This might give you an idea of what your eyes might look like at this time in the healing process. Her eyes are more visible and appealing. However, they are still swollen and the scar and upper lid is red. These are before and 3-month after photos of another man who had a browlift as well as an upper blepharoplasty performed. The excess skin on the upper lid is often secondary to a combination of the brow drooping as well as excess skin on the upper lids. These are before and 3-month after photos of a patient who had upper and lower blepharoplasty performed with incisions on the outside of the lids. Excess skin and fat were removed to allow her to look more refreshed and alert. This procedure, however, does not completely remove the wrinkles around the eyes or change the quality of the skin that is left behind. These photos were taken 7 months after she had an upper blepharoplasty performed. Her upper eyelids are more distinct and allow a larger surface area to apply makeup, although she does not have makeup on. Of additional interest is to observe the natural asymmetry she has in her brows, with her right brow higher than the left. These are before and 7-month after photos of a patient who had an upper and lower blepharoplasty performed. She is wearing makeup in both photos, but has more room after surgery to apply makeup on the upper lid. Although the results are subtle, she did benefit from the procedure as her eyelids are more distinct. These are before and after photos of a patient who had a browlift and an upper blepharoplasty performed. The top photos are pre-op. The middle photos were taken 1 month after surgery, and the bottom photos were taken 1 year after surgery. Although she has maintained a nice height of her brow, it is not uncommon to see more settling following this procedure. The combination of these two procedures have increased the visible area of her upper lid. These are before and 10-month after photos of a patient who had a browlift, upper and lower blepharoplasty performed. Before the surgery, this patient was unable to apply makeup along her upper lid, which is obviously an important location for a woman to cosmetically improve the appearance of her eye. Again, this excess upper lid skin is usually the result of progressive drooping of the brow as well as increased collection of skin from the upper lid. Having a browlift performed does not mean you have to look surprised. These are also before and after photos of an upper blepharoplasty. In the Asian eye, it is nice to have more exposure of the upper lid. The eyes look more open, refreshed, and inviting. This is easily accomplished with this procedure.
As we age, the brow descends and extra skin or hooding becomes more apparent above the upper eyelids. Identifiable and separate additional skin also forms along the upper lids, often with increasing prominence of the fat that surrounds the eye. It is crucial that your surgeon makes the very important distinction between what percentage of the extra skin is from the brow and what percentage is related to the upper eyelids. This distinction is critical in deciding which procedure or procedures are appropriate for you. The lower lids also begin to lose their tone and sag, and excess skin forms, becoming less elastic and wrinkled. The 3 pockets of fat in the lower lids also become more prominent. All of these changes contribute to an aged and tired look. Your eyes, the focus of your face, appear smaller and less energetic.
The goals of surgery on the eyelids are to provide a more youthful, refreshed, and natural look. Precise amounts of excess skin and fat may be removed to accomplish this. Because men usually want to maintain a masculine appearance, surgery around the eyes is typically more conservative and artistically different than in women.
On the upper eyelids, excess skin can be excised and prominent fat reduced to allow better visibility of the upper lid fold. This makes the eye look larger and more open and allows a larger surface for women to apply their makeup. Again, for men, usually a more conservative approach is taken and less skin is removed. Performing a brow lift at the same time will reduce the amount of skin to be excised from the upper lid with a blepharoplasty. This is because when the brow is lifted to the ideal height, less skin remains on the upper lid. An upper blepharoplasty requires having an incision within the skin fold of the upper lid to remove the extra skin. This scar generally heals very well, cannot be seen, and is of no consequence. On the lower eyelids, excess skin can be excised and prominent fat can be reduced to improve the appearance. Wrinkles can be improved but not totally removed with this isolated procedure. There are 2 choices for incisions for surgery on the lower eyelid. One is an incision just below the eyelashes on the outer skin across the eyelid. The other choice is an incision on the inner surface of the lower lid, which is called a transconjunctival approach. Incisions on the outer surface of the lid also generally heal very well and are not noticeable. By making this incision, extra skin and fat can be removed or modified, and the septum or container enclosing the fat can be tightened. If the incision is made on the inner surface of the eyelid, excess fat can be removed, but not extra skin. Thus, this transconjunctival approach is an excellent technique for those with bulging fat but no extra skin. This transconjunctival technique is often combined with accessory procedures such as laser resurfacing or a chemical peel of the external eyelid skin. By doing this, further tightening and improvement can be achieved. Although most people want to maintain the current shape of their eye, this may be able to be modified if desired. A canthopexy is a related procedure on the lower eyelid that is designed to change the orientation or tilt and provide additional tightening.
The proper technique to be utilized for surgery on the eyelids is based on your surgeon's comfort and judgment and your individual tissue qualities. Often, a laser is utilized to perform these procedures. Your surgeon should be able to discuss the advantages and disadvantages of these options with you and what would be the most appropriate choice in your case.